Hi, everybody. This is Rebecca Mills Anderson. I'm going to give a few people some time to catch up with us. It is the first 10 whole seconds of the live talk on postural orthostatic tachycardia syndrome. That is also called POTS for short. It is a type of dysautonomia. So I'll be telling you a little bit more about that, its relationship to SIRS, or chronic inflammatory response syndrome. As you show up, go ahead and give me a little hi in the comment box so that I know who I am talking to. It helps make things just a little bit less like I'm talking to myself in a room with Facebook, so that would be great. I'll be going over a little bit of a case study. Hi, Damara, so glad to see you. And of course, please leave your questions in the comment box and I'll answer them as we are going. Good morning, Angela. So glad that you're here joining us. Thank you so much for saying hi, both of you. I see that there's a couple other people joining us as well. So as people are joining, I'm just going to do the typical reintroduction of who I am, as well as, hi, Allie. Thank you for joining. I'll be putting in who I am, a medical disclaimer, of course, a little bit of a teaser. So let's get started on that. So first of all, my name is Rebecca Mills Anderson. If you see me looking over there, I've made some notes. I tend to be all over the place, especially because these cases are very complicated. So I do an outline so that my information is organized and easier to follow. So I am an integrative nutrition certified health coach, but more than that, I am a specialist. I specialize in autoimmune and neurological disorders and related disorders such as endocrine dysfunction and digestive issues. Hi, Natasha. I hope I'm saying your name right. Hello to Slovenia. That's wonderful for you joining us today. So I also run a website called MyCrazyJourney. And in my practice, I work under a health center in Alabama, in the US, in the state of Alabama, called Integrative Health Center of Alabama. Here I work under two functional medicine doctors, and one is one of the only certified functional medicine doctors in the state of Alabama, and the other one is in the process of that 5-year certification now. So I help, with their help, we help patients with autoimmune and neurological disorders and other chronic conditions. We help them take their bodies back from chronic conditions. MyCrazyJourney is a website that I created to support this community with anything from recipes to information, because I do believe that knowledge is empowerment and helps you really be more involved in your own healing journey. And it's just a great way to get additional information that I can't always get in the session, especially to those who haven't decided they need help. So I want to make a disclaimer that, hi, Katie, so thank you for joining us. I want to make a disclaimer that reminds you that I am not a doctor. And what's more than that is I am not your doctor. So this information in this talk, it is not to be considered or taken as medical advice. It is presented purely for informational purposes only. In this format, and in addition, unless you are my patient, I cannot answer any questions specific to your case, both because of liability and also because of ethics. But also every case is different, so I don't really know your medical history. So if you ask a question that crosses that, I'll just simply tell you, hey, I'm sorry, I don't have enough information to answer that, or I can only answer that if you're my patient, something like that. But please leave your questions in the comments, because I'll be talking about this in a very general fashion, and there will be a lot of information that I really could go way more into, and maybe I'm not, because we'd be here all day, but at the same time, if you want me to go into something, I would really love to do that, because I am very passionate about this. To kind of give people an idea, if you haven't read my story on mycrazyjourney.com, I ended up in 2014 disabled, where I couldn't even groom and feed myself. I was in the hospital and I was having daily seizure-like episodes. My motor skills were functioning. I lost 8 pounds in 7 days and was just withering away and very, very sick. My temperature was all messed up. I was sweating but cold. I was dehydrated, besides drinking like over 120 ounces of water a day. It just was very confusing. At that time and over the next year, I was diagnosed with my 5th autoimmune disorder, as well as 2 neurological disorders, one of which was postural orthostatic tachycardia syndrome. So I've been able to completely take back my body. Today was, this last summer was the first summer I went for a run, and it didn't hurt, and I could do it, and I wasn't limited. I wasn't worn out the next day. So that was a really big momentous occasion. I've been able to spread summers again, which used to make me completely disabled. And so I was very frustrated with conventional medicine because I had a neurological disorder that was being treated by a cardiologist who could only give me a pill and listen, but couldn't tell me why this was happening. And so I didn't accept that. I don't accept that. I didn't accept that. And I don't accept it for my patients either. There is always a reason why your body is working one day and then isn't working the next. And so when I started researching the biochemical pathways of how this takes place, I realized that the information was out there. It's just that the neurologist and the cardiologist really weren't putting the information together, and they weren't getting together with the other body systems involved, and they weren't treating root causes. So, I'm not here to beat up on anybody else. Everybody has that thing to do. What they do is manage medicine, and they're very, very good at it, and they save lives. However, I do something very different, and that is help people find the root causes and take their bodies back. So at the end of this talk, I will be letting those of you here know how you can start addressing your POTS or dysautonomia, as well as giving away a couple teasers on how to make some improvements today in your healing journey for those who suffer from POTS. So stay tuned to the end to get all of that. Please place your questions in the box, and I'll try to answer them after each section just as best as I can. So I want to start with the definition and description of what POTS is, just in case you think you have it, you don't know if you have it, you know you have it, you already know that, but just to kind of give an idea of what's going on in these people's bodies. Because I have asked a couple people to watch this because it has to do with SIRS and some of the same body systems involved. This applies to people who aren't sure. So POTS is an acronym. It stands for Postural Orthostatic Tachycardia Syndrome. This is science speak for when I stand up, my heart rate goes over 100. So sometimes it also is over 100 even when you're sitting down. So it's not necessarily when you stand up. So it's a type of dysautonomia, which is an umbrella over several syndromes that all mean the same thing. My heart and my brain are not communicating properly. Most people, when they stand, their body maintains what we call homeostasis. This is science speak for the body's ability to maintain balance. Different balance, meaning like they can regulate your heart rate, they can regulate your circulation, your blood pressure, all that. And there's something that happens when we stand up, our blood kind of shifts, and it takes about a few seconds for our body to say, oh, we're standing, let's move things around a little bit, let's change the way we're working so that we can maintain heart rate and blood pressure. Sometimes this can be broken enough, as I mentioned, to people not regulating even when they're sitting or laying down. But at the beginning stages, it really shows up when people are standing, because that's the greatest gravity differences in the brain, etc. Some common symptoms are that these patients have high heart rates. A tachycardia is defined as anything over 100 beats per minute. They either have low or high blood pressure that correlates with their high heart rate. Other common symptoms are depression and anxiety, extreme fatigue and weakness of the muscles, passing out or near passing out, which is a hallmark indicator that you're dealing with POTS. Seizure-like episodes, which I've watched a couple of these, and they are all very, very different. They're all very different. You could probably look up some videos. For me, my breathing would cut off. The inflammation in my lungs would make me gasp for air. My body would be trying to pass out. I would simultaneously get, my hands would draw up like this, and like all the muscles would impact on themselves. It even felt like the muscles around my rib cage were closing in on themselves. And extreme muscle weakness, and there was long-term neurological damage after these episodes. And so they were a little bit scary, and sometimes I definitely did pass out. Sometimes I didn't. A lot of times the stress that my body was going under, I didn't remember everything that happened. So like my last one was summer before last, and I'm really curious to see what the EMT saw, because I don't know what happened. So everybody's experience is different. So I've watched some others, and they didn't have the drawing up, and they didn't have the breathing. So everybody's a little bit different depending on their individual. They also have these seizure-like episodes may be mistaken for panic attacks. And first I want to speak to those who, if you're having a panic attack and you are not anxious, you are completely calm, that is a red flag. You cannot have a panic attack without panic anxiety, Now, physically, these symptoms are what's happening in your body. Physically, the adrenaline, the heart racing, even my breathing, all those things are the same physical symptoms that may be happening in a panic attack. But this could happen when I'm completely calm. It could happen when I'm sleeping. It can completely happen when I know I'm completely safe, when there's no emotion attached at all. And that was a big indicator that these were not panic attacks. So if you're having that kind of similar things, you may want to investigate further. Hot flashes and temperature dysregulation often come with this. As I mentioned, I was covered in sweat, yet cold, in a perfectly comfortable room. Dizziness, lightheadedness, either upon standing. You may have vertigo when you're walking. You could have dizziness upon standing. You could have blurred vision or anything even when you're sitting. You'll have headaches. Very common is to have pain in your neck and your lower back, and that is for a chiropractic reason that's associated with this. That also contributes both as the effect and the cause of the vicious cycle that your body gets in, that I'll talk about later. You'll have gut problems. We have a lot of cases of gastroparesis, poor sleep and visual problems. Blurred vision is not uncommon with these patients, and it is often compared to having congestive heart failure in its more extreme forms. So Alex Robinson says, I have definitely experienced many of these symptoms. It's very comforting to know when you've gone through what I'll just be honest, I'm just gonna be blunt, it's hell. And when you've gone through this, it's very scary before you realize whether or not you're safe. And it's good to know that we're not the only one. Angela talks about pain radiating from her neck and lower back more than any other place in the body. There are very good physical reasons for this. I'm gonna pin that comment because I want to come back to that later about some of the why that happens. And let's see, Allie says that she has vasovagal syncope episodes. So some people say syncope, some people say syncope. I say syncope. I'm sorry if I'm pronouncing it incorrectly. Episodes were always accompanied by the feeling of anxiety due to catecholamine release. She had hyperadrenergic pops. So that anxiety definitely can come with those things, even if there's not a reason to be anxious, because of the excess adrenaline that is concurrent with these episodes, as well as just your basic state, as I'll explain later, is that you have excess adrenaline all the time. And that's basically the root cause, excess adrenaline. So I want to tell a little bit, does anybody have any questions about the definition or description or anything like that? Let's see, don't see any coming in. If I do see any coming in, I'll come back to that. So conventional medicine, as I mentioned, I was a little frustrated as a patient with conventional medicine and all that has to offer. And honestly, I'm frustrated with conventional medicine and what it has to offer from a practitioner standpoint too. So in conventional medicine, this is most often treated by cardiologists, even though it's a neurological disorder. So it stems from your nervous system and your brain. However, they're treating the heart. So it's just an example of how conventional medicine treats things differently than functional. The most common treatment is beta blockers, even in cases where there is low blood pressure. And supplemental treatments are things like saline IVs, and salt tablets are often used. These salt tablets are made from table salt. They can be very helpful in an emergency to help raise blood pressure, but I'll be addressing that as a long-term solution in just a minute. In functional medicine, it's a little bit better because this type of medicine is known for asking why. But I got to be honest, my experience with this when I went to my functional medicine doctors is they had very little to offer also. They could run the usual tests and they could ask why. But even one of the things that kind of, and Kaylee says, can you have varying degrees of this? Absolutely. Oh my gosh, yes. I get up heart rates from anywhere from 101 to 250. Passing out, you could get a little bit of faint, or you have complete faint and hit your head and end up with a concussion. The disability could be, I have trouble standing still in line, to I can't get off the couch and groom and feed myself. Some can't shower by themselves. It just depends on how much else is involved, what degree of severity they are, and some underlying factors like some of their whys, like how extreme are their whys. Alex says, I was always worried about my blood pressure would bottom out if I took a beta blocker. I understand completely. We had a lot of trouble regulating my blood pressure and heart rate. I tried the beta blocker and it was like hitting a moving target. Some days it would be great, and other days it would make me feel so sick, and it would put actually more stress on my heart because my blood pressure was so low, it's actually stressing my heart out to pump the blood through my body. And so it's not right for everybody. So a lot of people are looking for alternative solutions. Okay, so in functional medicine, my experience was a little bit better, but a little bit worse. I went to my functional medicine doctor and she said, I'll try everything I can, but she didn't really know a lot about it because they don't really, it's not something they spend every day on. So unless somebody has had to tackle this specifically, it's kind of like a specialty, so to speak. So even in my beloved functional medicine doctor, I'd been with her since 2008 and I got sick in 2014. Yeah, it's very scary. 2014, and she knew my medical history, and there were some things in my medical history that were indicators that something deeper was going on, but we just didn't have the ability to address it anymore. So even in functional medicine, I can find that the treatment, in my opinion, it's still lacking a little bit. So it's my allegation that these depressed adrenals, hormone and neurotransmitter imbalances, nutritional gaps, etc., while they are certainly necessary and very helpful in treating these conditions, I call them, I just kind of differentiate between two levels of root cause. You have the disease here, here's the root cause that they treated, there's adrenals and there are hormonal imbalances and there are neurotransmitter imbalances, there are nutritional gaps in these patients. However, some of those things have their own root causes, and this is where nobody is really going. Why are there long-term adrenal fatigue? Why can't we fix the adrenal fatigue in this person? Why can I not fix the nutritional gaps? Why are there neurotransmitter imbalances? And these are questions that I'm a little frustrated with, that people just really aren't asking. You know, yes, there's a neurotransmitter imbalances, but why? Dig deeper, go to the root of it. And until the reason becomes because this person was born this way, you're not there to the why. So these root causes have their own root causes, which leads to my very basic question. Thank you, Sarah. I appreciate that vote of confidence. Yes, hyperandrogenergic POTS has been shown to have an autoimmune component. I'm going to talk about the relationship to autoimmune. We're going to do a case study in a few minutes, and I'm going to explain how this begins, how it ends, and where it goes afterwards, using a case study that will be very, very metaphorical, and I'll show you how to adjust that case study to mirror your own history. So I want to lead to a basic question. I did a couple talks on CIRS, which is chronic inflammatory response syndrome, and I would never, ever, ever take a dysautonomia case without screening for the genetic component to CIRS. So these symptoms are all created by the dysfunction of the autonomic nervous system. They are also symptoms of CIRS, which is also called mold or biotoxin illness, but is not exclusive to mold and biotoxin. The exposure to mold, biotoxins, or certain chemical sensitivities to an individual with the genetic predisposition to CIRS causes the exact same markers, the exact same symptoms found in dysautonomia. And they all stem from the very same part in the brain, the hypothalamus pituitary. One of the markers for CIRS is hypothalamic pituitary dysfunction. And I can trace every single person's medical history, starting here to every other part of their brain, nervous system, and body by starting here and going through the medical and personal history. This same thing, I can do the same thing for CIRS as I can a dysautonomia. So we have the CIRS, the same markers we find in both cases are hypothalamus pituitary distress, hormonal imbalances, and neuroinflammation. Well, they're the same in both cases. CIRS, why it could be a misdiagnosis of CIRS and why it would be POTS in some people and not others is that CIRS expresses itself differently in every single case. So one person gets POTS, the other person gets lupus. Some people get both. But it's the same basic cause. They just, different toxins go to different parts of the body, different imbalances. It's just that a CIRS umbrella is all the toxins and all the dysfunction. So if the markers are same, how can you tell which is which? It is my allegation that POTS is more often than not a misdiagnosis and a complication of multiple things. I'll talk later about it being a mosaic disease or a puzzle or a perfect storm. So pay attention to that part when I get there. So I'm going to pin that too so we can kind of go back to that to remind me to do that. So CIRS is less about the symptoms and more about the cause, where POTS, the diagnosis, is more about the symptoms and less about the cause. So you can have CIRS that causes POTS, and they're the same thing. So some people would call that a misdiagnosis. Some would call it a subset of SIRS. You could call it all different things. Okay, so although it has symptoms, each person has a different set of symptoms in SIRS, such as, for example, one person who has SIRS may have thyroid disease, and not everybody has the same symptoms. Another person may have lupus in SIRS. Another person may have dysautonomia. So it's more about the cause and solution in SIRS and more about the symptoms when it's POTS. So, and other people will say, no, but my case was caused by a virus, or it was caused by autoimmune, not by mold. So here's my response to that person. Each case of dysautonomia and each case of POTS is different in the exact why. And I use that why loosely. What I really mean is the word trigger. So its trigger is different. Some are brought on by viruses, some are brought on by surgeries, autoimmune disease, hormonal shifts such as puberty, menopause. Puberty could be at 13, it could be at 19, it could be at 40, 35, it could be 55, 60, whatever. It could be brought on by a traumatic event such as a divorce, such as a rape, such as adverse childhood experiences, which we'll touch base on later. But I want to point out that what all of these triggers have in common, they all have one thing in common for every single trigger. They are all a great stress to the body. I want to let that sink in. So whether you have a virus or a surgery, or you give birth, or there's hormonal change, or your parents got divorced, or you were raped, or you were abused, it's all whether it was gradual or sudden, it is all a great stress to the body. So the true fact is that the body has been under stress for a long period of time before the triggering events. But these become the trigger because they are the proverbial straw on the camel's back. In the context of Alzheimer's, Dr. Bredesen talks about the threshold effect. He talks about a ceiling with holes in it. And it's not the first ceiling that causes a flood, first hole in the ceiling that causes flood. It's not the second one, it's not the third. It's like at the 50th one that you develop Alzheimer's, or the flood in this ceiling metaphor. Dysautonomia is the same type of disease. It has also been called a mosaic disease, meaning there's several pieces that create the picture. I refer to this type as a 100-piece puzzle. And if we have as much as 51 pieces, we tip the scale in the direction of being symptomatic. Now, I'm not talking a literal 100 pieces, and I'm not talking a literal 51. That's just a good way for me to communicate what I mean by that. Any questions about what I just said a little bit? Stress kills, we talked about testing for lupus. Are there markers the same? Can you tell which is which? A genetic, Angela, I want to talk about which is which. So if you have dysautonomia and you have the genetic marker for SIRS, there's a 98% chance that what you have is SIRS, because 98% of cancers of causes of SIRS is that genetic risk factor. There are 2% that don't have the genetic combination for SIRS, and it's feasible that the same biochemical pathway could form without this genetic position. But even without the genetic disposition to building up these toxins, you can still build up the same toxins. So you can still have, if a long-term exposure and a long, huge buildup, you can still have that, but these people tend to get better quicker, and they tend to be easier to address. Let's see if there's anything. What labs are best for genetic testing? I go over that with my patients, so I'm not going to talk about it here because a lot can be done wrong, and each case is different, so each testing is different. So I'm going to save that for people where I can control that kind of information. What's the correlation between the limbic system and POTS? I've seen 2 people use D and RS to cure it. Amy, I absolutely 100%. There is the deep limbic system houses the autonomic system. So there's the connection. I'm going to go into that on my case study so that I can really explain that and go into it, because it's super nerdy exciting about once you can find the cause, you can do so much about it. So I want to take this moment to also talk about some of the overlapping medical conditions. And I apologize, I'm really thirsty. I'm going to take a little sip. Thank you. Thirsty. Okay. So some of the overlapping medical conditions that are also associated with these cases. I find it rare, and I don't know if I've ever found a case of POTS that does not also have other things going on medically. Some common overlapping medical conditions include celiac disease, which is more often than not undiagnosed and related to SIRS. medical conditions, and a lot of times they'll leave, or a long history of what I call pre-celiac. This means you carry the disease, and while your body is not attacking the intestines, it's still causing inflammation and dysfunction in the body, such as gluten-related disorders, such as thyroid, ADD, OCD, schizophrenia, and bipolar, depression and anxiety, and more. These patients also suffer from mast cell activation disorder, multiple chemical sensitivity, say that 3 times, gastroparesis, autoimmune disease, especially gluten-related ones like Hashimoto's, MS, RA, Sjogren's, etc., lupus. And there also seems to be an unusually high amount who are also diagnosed, I want to let this sink in, I'm going to slow down. There is an unusually high amount who are also diagnosed with a connective tissue disorder, such as, but not exclusive to Ehlers-Danlos syndrome, also called EDS. Some may be undiagnosed or some may not have it. That is unclear to me at this time. And many are told they have hypermobility syndrome, which basically means that they're hyperflexible, double jointed, or something of that sort. There's also a percentage with chronic viruses, such as CMV or chronic active Epstein-Barr virus. They also have chronic fatigue syndrome, just to name some of the most prominent related disorders. So it is a humongous holistic breakdown of the body, and they all are coming from the same beginnings. So how does this happen? So I am going to explain exactly that. So I'm going to do a case study. Now this case study could be anyone. The overlapping diseases may change from person to person. So just, follow the pattern and then kind of apply it to you. The triggers could be hormonal shifts. They could be changes in physical environment, like starting a new school or moving, or just traumatic events. They could be an age that you're at. All those things are different for every case. So as I tell this story, feel free to sub each of those out for a different age, a different trigger, etc. These things are details, but all the details from one case to another have themes in common. Changes in biochemistry that affect inflammation and neurotransmitters. So depending on diet, self-care, physical and emotional environment, the disease process may not express itself as POTS until much later, perhaps puberty, perhaps even age 30 or 40, 19 or 20 years old, 13. It could be a hormonal shift or a virus. Any kind of change to the biochemistry can be a triggering event, but as I said before, it doesn't start there, it just triggers there. So neurotransmitter shifts such as estrogen or adrenaline or cortisol could be one of those things. It may be a physical environment. It could also be the result of a slow buildup over time from that physical environment. So you could have had homeschool kids in a moldy house that they didn't know mold, or it was tested improperly or whatever, and they won't be symptomatic until later in their life. For example, they may have complications or some of these overlapping things earlier in life, but they don't really have these kind of things unless that all the right things happen in place. Someone says, overwhelming to know how so much overlaps and ties together, making health concerns very hard to figure out. Katie, you're really right, but at the same time, it makes them so easy to solve, because if they all have the same root cause, then they all get better with treatment. And so if you can really treat that root cause, it actually makes it much simpler. So instead of doing 5 programs to treat 5 diseases, I can do 1 program to treat all 5. And that is extremely exciting. So when someone comes into my office and they have dysautonomia and they're also having thyroid problems, and they say, Rebecca, I'm really worried. I'm here to lose weight because I have a rash and blah, blah, blah. Help me with my weight. And I go, oh, wait a minute. You have dysautonomia. You have this, that, and the other. And I tell them I won't work with them unless I can treat all of them, because the only way I can really help them is to treat all of them. So take that as a little, what lab results can express how long the disease has been present? That's a very long answer. There are literal books written on it. So I'm sorry, Angela, I don't really have a good answer for that. It's like over 10 of them. So, and also a complete medical history would help me put that together. Some answers, some things can't be answered. For example, when I have people have depression and anxiety at 3 years old, I can't go find out what their house was like when they were 3 years old, because it was so long ago and nobody knows the answer. So we just have to make some educated guess based on what information we can put together. And bottom line, so how long the disease is present is just, we can try to put the picture together, but in the end, it's just, let's just fix where we are now. Some things later I'll talk about how there's certain markers that are one way at the beginning of the stage and one way at the end of the stage, and there's a different place in the middle. So certain lab tests, for example, cortisol will be high at the beginning, it will be adrenal fatigue in the middle, and it will be completely depleted and affect much more and cause excess adrenaline in the very later stages. Do I work with clients remotely? Yes, Rachel, and I'll be addressing this. So if anyone wants to work with me remotely, I'll be telling you how at the end of the talk. So I'm going to get right back on that case study. Very easily to get distracted with these wonderful questions, but thank you, keep them coming, because I'd rather be distracted with wonderful questions and be able to answer your questions than be perfect. Okay, so I'm going to need this case study. So I'm going to give an example of how it takes place. So first we have a person who begins with something simple, like a little depression or a little ADD, maybe some OCD or some other case. For the sake of this study, I'll be using a child who is diagnosed with OCD at a very young age. So the baby or child does not display signs upon birth, but a few years later. Perhaps they show up at age 2 to 4 or upon school age. It could be triggered by a new physical environment causing the shift in cortisol adrenaline, such as a new school, home, or even a trauma such as a divorce or a parent being absent. It could also be stress in the home. It has been proven that adverse childhood experiences such as a divorce, a parent in jail, being around drug and alcohol abuse, these can exacerbate and speed up this process and contribute to the severity and expression of a toxic buildup. So you're in some poor form of whether internal or external toxin. And some people are, genetically prone to building up faster, but also our physical and emotional environment, whether or not we're eating enough vegetables, whether or not our parents are nice to us, they can affect our ability to detoxify. So when it starts in early childhood, then the child may have abnormal emotionalism and is diagnosed with something, say OCD for the sake of this case study. A few years later, the child is then also diagnosed with ADD, and then later starts to show signs of POTS. So in this individual, the neuroinflammation started in one part of the brain. So according to and I'm going to use my head as an example. According to Dr. Daniel Amen, OCD happens in the cingulate, which is right here on the right temple side of the brain. ADD is right next to that. That's the very front of the brain. And then the next part, the depression and anxiety, is happening on this side of the brain. They're all touching each other. This is the deep limbic system that has a depression and anxiety. Then the neuroinflammation is affecting the hypothalamus pituitary enough to where it affects the adrenals, the immune system, the cortisol, adrenaline, maybe even the thyroid. So maybe they have trouble gaining weight or trouble losing weight, depending on what part of the thyroid stress that they're in, et cetera, et cetera. So according to Dr. Daniel Amen, he uses the word inflammation and dysfunction in the brain as synonyms. So you can track through the medical history. This is age 3, the inflammation was here. This is age 12, the inflammation was here. Age 14, they get depression and anxiety, and age 15, they get POTS. So I can track that person's medical history and correlate it with certain things in their family, such as their parents divorced when they were very small. There was drug use in the household. One of the parents went to jail. They had to move somewhere else. There was mold in the house. There was a poor diet full of the standard American diet. There was not enough vegetables. This person had a sweet tooth. They ate too much junk. Whatever. All these different things can paint a picture of how this came to be. So it wasn't just one thing that caused it. It was a bunch of things. And especially when I had parents coming in with their children, I want them to know this is not their fault. They didn't do anything differently than anybody else. It's not anyone's fault that this happens. It's just crap luck. Let's just be honest. It's crap luck. So let's see, after we track that inflammation there, the inflammation and therefore the dysfunction has spread in this person's brain. The inflammation continues untreated and unaddressed, other than by conventional medicine, and eventually reads the deep limbic system of the area of the brain. This is a name that Dr. Daniel Amen calls that area. This is responsible for depression and negativity. It also houses the hypothalamus and pituitary, which control autonomic dysfunction. Now in many, this may not affect the autonomic system, but something about this individual means that it does. This factor may be a connective tissue disorder. It may be some other unknown X factor. It may be the SIRS gene. In another individual, it may be express itself as chronic fatigue, or it would be just thyroid dysfunction without POTS instead of all put together. But something in this individual caused enough stress to the hypothalamus pituitary where it became unable to regulate the autonomic nervous system. So the stress to the hypothalamus pituitary then causes long-term stress to the adrenals. This often expresses itself as could then turn into thyroid problems or chronic fatigue or blood pressure and heart rate issues. But the long-term stress of the adrenals causes the suppression of the immune system, resulting in eventual autoimmune disease, likely triggered by the same toxins that cause the brain dysfunction. This toxin may be mold and or other biotoxins, chemicals, gluten or other foods, or all of the above in the very luckiest individuals. It could be triggered by Lyme toxins. It could be triggered by bacteria. It could be triggered by anything that causes that from leaky gut to leaky brain, or something in the bloodstream that didn't come from the gut at all. If this same individual also has a dormant gram-negative virus such as Epstein-Barr virus, then this creates an environment that allows that virus to come out and be active. Just FYI, in case I haven't made this absolutely clear, dysfunction and inflammation are synonyms. So I will use those words really interchangeably. Inflammation is really the precursor to dysfunction. But if you have dysfunction, you have inflammation. But you can have inflammation with no dysfunction. So I will use them somewhat as synonyms. This constant stress on the body causes a perpetual state of fight or flight and inflammation, causing a progression of the POTS, the slow climbing of the heart rate, the inability to regulate your digestion and your heart rate and blood pressure. It also can trigger things like thyroid and Sjogren's disease, because those are also tied to the hypothalamus pituitary. It causes complications such as gastroparesis, the excess adrenaline, long-term adrenal fatigue. Eventually, when your body goes without cortisol for a long time, it will try to balance itself by producing too much adrenaline. It's trying to do this because it needs that adrenaline to control your heart rate and blood pressure. Problem is, this is not balanced. This is your body's Band-Aid because it's so out of options. It's desperate. It'll throw anything in there. But this is its best thing when it just has tried so long to regulate its own cortisol, and it just can't. So this excess adrenaline either makes it worse or causes gastroparesis and fibromyalgia. Plus you have the neuroinflammation with the fibromyalgia in addition to the excess adrenaline. So you got to have yet another mosaic disease on top of your mosaic disease. So hormonal disruption, immune disruption, they are all centered from the hypothalamus pituitary and then affect every other system of the body. With a dysfunctioning autonomic system, your body gets stuck in fight or flight, which starts out with excess output from the hypothalamus pituitary at the early stages. Then it goes to low output from the hypothalamus pituitary because the hypothalamus pituitary can't keep up, and it slows the output, affecting both the thyroid, adrenals, blood pressure, blood sugar, heart rate, dizziness, etc. So again, the later stages, you end up stuck in fight or flight. So anybody have any questions about that? About that case study where it starts out as like just a little neuroinflammation, then that neuroinflammation spreads, and then that dysfunction spreads to the other parts of bodies that are affected by the hypothalamus pituitary. Any questions? Okay, nothing coming in, so I must have explained it well. Yeah. So I have some commonalities between the different cases. There's HP dysfunction and therefore HPA dysfunction. A lot of times I can find this in the TSH because the ACTH is either usually not tested or it's only tested by conventional standards. And their range is a little bit wider than what I would call a functional range. Even though I haven't come across a functional range, if we did have a functional range, it wouldn't be based on the same thing as conventional ranges, because conventional ranges are determined by everyone who's ever taken that test and therefore everyone who's ever been sick with it. So where functional medicine ranges, when we have a range, it's determined by what the studies say make it feel well. So if we don't have enough information to have these studies, we can't have a functional range. So someone said meditation, not really related to the case study, but what are the studies on meditation and getting out of that fight or flight? I'm so glad you asked that. That is definitely a really good thing. When I figured out what was causing mine, and that was excess adrenaline, I literally tried everything I could find to lower adrenaline, and I tracked the data. And so that's how I came up with my custom protocol of things that could be put together to reduce the adrenaline to a normal state, how to manipulate your body to doing what it needs to do, whether it be through lifestyle or food or all of the above, or functional medicine, or again, all of the above. And meditation definitely plays a role out of that. In fact, I'll talk a little bit about ways to do that. I have a freebie at the end that's going to help with people for digestion, but it also talks about that relationship to these cases. So Katie says, well, you've definitely explained that well and resonates big time for me. Hallelujah. So how do we get that butterfly flight? So that is not a simple answer, and that's why I've developed my programs. My programs are 6 to 8 months long. I prefer them to be 8 because these cases are so complicated and because your body is so imbalanced that has created this stuckness, and you need to learn. And through that imbalance, because we've had these elevated anxieties and elevated depression and elevated stress, we have found other coping skills that are not helpful. For example, and I'm going to be real honest real quick, my family's coping skills were to drink or to do drugs. And so when I wanted to stop hurting myself, I had to find something that was not a glass of wine to lower my blood pressure, or to, because mine was actually low, so in ways it was making it worse. I had to find something other than that. So I had to learn new coping skills. So coping skills, including meditation, there's several lifestyle factors. It literally would take me an entire book or 6 to 8 months to teach somebody how to do that. So I apologize, I don't have a good thing, but that's something that I definitely teach my patients depending on where they're at, because every case is different also. Because someone might have great coping skills in one area and not in the other. Okay, so commonalities, again, we talked about the HB dysfunction. Hormonal imbalances are also common. They may have low DHEA, progesterone, etc. They may have low estrogen or progesterone. All of these are neurotransmitters and directly affect the way the hypothalamus pituitary works. So it becomes a vicious cycle. The stressed out hypothalamus pituitary then lowers the neurotransmitters, and the neurotransmitters are no longer feeding the hypothalamus pituitary. So you really need someone who can come in and get you unstuck from that vicious cycle of not producing enough estrogen and not having enough estrogen in order to get it to working in the first place. They will also have some sort of cortisol dysfunction. As I mentioned before, early stages, it's excess output, and in late stages, it is just completely kaput, and then in the very late stages, the excess adrenaline will have taken over. There will also be nutritional imbalances that will affect blood pressure, heart rate, and blood volume. So not detectable on a blood test necessarily, but rather upon inspection of monitoring the intake of specific nutrients compared with their ability to absorb their nutrients. And I'm going to tell you right now, nobody in America, unless you are supplementing and tracking and doing a very diligent way of tracking the information, is getting enough of your electrolytes that will control your body's ability to have cellular hydration in order to regulate your hormone and blood pressure. Not to mention your body's under so much stress, you need different quantities anyway. That's a very long process to teach somebody what to do and how to do it just on the nutritional part. And these, again, may not show up in a blood pressure, in a blood test. They may not show up on tests at all. But by maximizing that nutrition that helps with these, we can, because we're also talking about absorption issues. We're also talking about comparing to other people who don't have the mosaic, the other 51 pieces in the puzzle. So very individualized program there. We would look at leaky gut, poor digestion, and food intolerances, as well as leaky brain. If they have neuroinflammation, then you can assume leaky gut and leaky brain. And if you have POTS, you have neuroinflammation, let's just be honest. They often have poor digestion as a result of a constant fight or flight, which sets them up for fungal infections, bacterial overgrowth, and leaky gut, and more because of the low stomach acid. So that constant fight or flight, the reason you end up in gastroparesis is because of long-term shutting off of the digestion. So the vagal nerve, basically, because that is responsible for digestion, the hydrochloric acid, which is responsible for digestion, and all the inner workings, they basically hibernating because you've been in fight or flight for so long. Toxins are another area to address. Food toxins, mold, chemical, viruses, or all of the above, depending on the case. So we go looking for all those things to figure out what's going on in this individual and address them and fix it. These chemicals are what caused the original inflammation, and then this exacerbated with increased toxic load as time went on. So if mold in my house wasn't making me sick by age 3, but it might make me sick by 12, I might have POTS by 20, or I might get it when I move out and have other ones on top of that. These are things that we want to address. So we're going to address every type of toxin and really find out what's going on in this individual. We're also looking at neurotransmitter imbalances. The neuroinflammation and poor gut health with a constant fight or flight can lead to poor production and imbalances of several neurotransmitters and affect the receptors for those neurotransmitters. So I told you at the beginning I was going to give away a couple freebies at the end. So first I want to give away one of my biggest free tips, and this is going to blow your mind, and it might it might make some people a little uneasy. So I'm going to definitely go into this. So, you know, it is what it is. I want to address one of my pet peeves and how conventional medicine manages these cases. And I want to do that by dispelling the most humongous myth known to man in these cases, and that is salt. So if you have high blood pressure, you'll think this part doesn't apply to you because you weren't using salt to raise your high blood pressure. But some of it does. So pay attention and look for those parts, because what regulates blood pressure, whether yours is high or low, it really comes down to the same solution, and that's balancing electrolytes, which I'll explain in a second. There's a myth that if you have low blood pressure, that you should eat a lot of salt and drink a lot of salt water and sugar-laden sports drinks like Gatorade, etc., which, by the way, have very, very little electrolytes in them. They have, I mean, extremely small amounts. It's ridiculous. The myth is being spread by doctors and the POTS community. And short-term, this does work. It is great for emergencies, but over time, this makes things worse. You are making yourself sicker by pouring in table salt into your body or eating a whole bunch of packaged processed foods for their sodium intake. You are just absolutely, you're going to get worse and worse. So when you have a high sodium intake, especially when it's table salt instead of sea salt, but you're not consuming the optimal daily allowance, that's the maximum safe intake of your electrolytes, you are actually causing more stress on your adrenals, more stress on your hypothalamus pituitary. You're creating more imbalances in your heart rate and blood pressure. Electrolytes balance blood pressure and heart rate, but they work in concert with each other. So if you have a high salt intake while having a moderate or low potassium intake, then there's no way your body can regulate its heart rate and blood pressure. It doesn't have the raw, bare tools. So let me assure you that unless you are tracking and hitting the ODA of potassium daily for a long-term period of time, and I'm talking years here, then you are driving down your potassium levels. A banana a day is not going to do it. A banana has about 60 grams of potassium, and your need is 4,700. It would take 78 bananas a day to hit your goal. This high sodium and low potassium intake will also drive up or down your other electrolytes, creating more imbalance. This also messes with your magnesium levels, which there is no standard dose. That's a bio-individual dose. You need more when your body's under stress. Guess what? Your body's under stress. So you need help figuring that out. Your calcium levels will also be affected, regardless of your intake. If you have imbalance of either of those, it drives your internal levels up and down. Add in your inability to absorb nutrients because of your poor digestion, and it's even harder to figure out. So most of us have poor intake. Even with eating 9 to 14 cups of vegetables a day, most with this amount of stress on their body would need to supplement and tweak their diet. This also assumes that they are absorbing everything they're eating, which we've already established that most of these patients are not, which means they need great gut health and no grains, seeds, nuts, or legumes that are not soaked or sprouted. These patients and most Americans have none of the above. They don't have good intake. They aren't taking supplements. They aren't balancing them. They're eating plenty of foods that have lectins and phytates that block your nutrients. They have poor gut health, and that's when they're not sick. So when you're sick, these imbalances cause a lot more problem. For those with high blood pressure who then have a reduced sodium diet, this imbalance can cause poor blood pressure regulation also, as well as poor digestion, because again, these things work in concert. So best way to get electrolytes. I don't even know how to answer that. There's several different ways. There's specific focus foods, which I teach people how to do focus foods. Some of them will be compliant, some won't. We'll have to find other focus foods for them. We do the focus foods, we fill in gaps, we track the data, we use specific ones. Potassium bicarbonate, is it helpful? It can be helpful. The question is what is the right dose for you? Most potassium supplements come in 99 milligrams, and I'm going to recommend against maximizing your potassium without having a qualified, skilled individual help you balance and maximize all your electrolytes. Imbalancing them and having excess take of potassium or any of these could cause further irregularities of heart rate and blood pressure. So it can be dangerous if you do not know what you're doing. So please don't do this with help. Jan says, sounds like an overwhelming amount of tests and expense. Not necessarily. Not necessarily. I won't go into a lot of that because I talk about that with individuals. It can be very expensive if you did it the expensive way, but there's some that you don't need right now. So there's some things I don't need to know. If someone has already diagnosed you with dysautonomia, there's no need for me to find out what they already know. If there's something we can't act on for a year or two, there's no point in me running the test to find out how we need to act on that. So there are lots of ways around budget. There's also when people like for example, is working out going to dysregulate things? Yes and no. The most consensus is that working out will improve things, but you can overdo it, and there's a way to do it to help things, and there's a way to do it to hurt things. So that's another thing that a qualified, skilled professional would be able to guide you on your individual case. I have chronic low blood sodium levels. So with mineral quality salt increases, inflammation just goes up. Yes, that has to do with the balancing act again. There has to be a balancing act. There's also absorption issues to look out. I can't speak to your individual case because I don't know your lab results. There's a lot of questions that I would ask. The questions that I would be looking at is how am I balancing my other electrolytes, and where are my receptors, and what are my other sources of inflammation? So that would be something that I would be looking at. Let's see. So here's the solution my blanket thing. And again, this is, each case is individual. I cannot give you individual recommendations unless you're my patient, both for ethical and for ethics and also for liability, because each one is so different. So a no salt diet, which is often recommended for high blood pressure, can also result in not fixing the balance between the minerals. It can also exacerbate gastroparesis, poor digestion, and poor gut health. It can also exacerbate neuroinflammation by way of increasing and preventing the healing of leaky gut, a precursor to leaky brain, which then leads to neuroinflammation. So here's the solution to salt. In my program, I custom blend healing protocols. I track nutrition data because that is going to be very individual. I don't know what your intake is, so I can't tell you how to fix it. And until I know all those little factors and all these whys, it is a puzzle. And so there's no way over Facebook or without a proper medical history and lab tests and things like that, I can't know what your full picture looks like, because I can't tell you what piece of the puzzle is missing and what is, you have too many of the left side of the picture or whatever, to use the puzzle metaphor. So let me go back to where I was. So I coach people to improve their nutrition, their absorption, their digestion, their electrolyte balance, so that they're no longer dependent on saline IVs, salt tablets, and other unhealthy methods of raising or lowering their blood pressure. This in turn supports a healthy heart rate, healing of leaky gut, leaky brain, calming the neuroinflammation in the brain and all over the body, and also allows me to address digestion. So it really is a holistic whole point. There's no one thing I can say, do this, and it's going to fix it, because each case is different and there's such a big puzzle. The rest of the picture is addressing the hypothalamus pituitary dysfunction with food, lifestyle, and functional medicine, as well as hormonal balancing, addressing neurotransmitter deficiencies and excesses, and eventually removing the toxin that has started the whole process in the first place. This may be a toxin that's stored in their body and or a toxin that is in their physical environment. And that is not a short journey, but it is worth it to these patients who have lost their lives to this disease. Some as early as 14 years old, others in their 20s, still others in their 30s and 40s. So I want to talk a little bit about gastroparesis, because I feel like this is one of the most debilitating parts of it, is just not being able to eat. How can you get well if you can't eat? If you can't digest food, it's horrible. So unless there's physical damage to the vagal nerve or to the stomach that would affect its physical ability to digest, gastroparesis is reversible. It is not a death sentence of feeding tubes, surgeries, and more. It is a natural response to your body being in long-term fight or flight, in which the body shuts off digestion. So the trick is to get out of fight or flight, as we talked about earlier. This is easier said than done, but in the short term, there are things that you can do. So I want to leave you today with a little freebie. For those who sign up for my newsletter by Monday, I'm going to be sending out on Monday a handout on improving digestion, and it's going to include a link to a video that teaches you how to manually stimulate the vagal nerve and to turn digestion on. This is not to be used without the guidance and permission of your healthcare provider, for it is a very aggressive act, but it can get people to digest within 30 minutes when it's used properly. So that link will also have a couple of other things that on there to help you, even if you don't have gastroparesis, improve your digestion and to kind of practice shutting off fight or flight, at least for the point of digestion, and how to stimulate that rest, digest, and heal state of the body, which is opposite of fight or flight. So I'm going to put into the comment box the address to get the freebie or to sign up for my newsletter. And if you sign up at this link, you get a second freebie today. I have a freebie that I'm giving out right now called the Winter Survival Guide. The Winter Survival Guide is a 4-week blueprint for batch cooking. Each week is different. You batch cook on the weekends and you make simple, very quick weeknight meals using what you batch cooked on the weekends. It gives you the recipes for each weeknight meal as well as the batch cooking. There are snacks. It's dinner for 4 weeks basically. And it is completely paleo, nutrient dense, walls friendly. It does have some tomatoes, so some substitutions can be made if you're AIP. If you're on celiac elimination protocol, some substitutions can be made, but most of it is celiac elimination protocol friendly. So you can get that freebie right now for signing up for my newsletter. And then on Monday, those who sign up by Monday will get an additional extra email that will have a handout in it, or a link to a handout that will tell you how to improve your digestion by getting out of fight or flight before every meal, as well as a link to that aggressive manual stimulation of the vagal nerve that can get you to digest within 30 minutes. I feel like being able to digest is the first step, and that's why I wanted people to have these tips and those links. Again, disclaimer, check with your healthcare provider before using any of the recommendations for me and make sure that they are appropriate for you. Otherwise, they are at your own risk. So again, you get the bonus gift of the Winter Survival Guide when you sign up at that link, and then the handout that I sent out on Monday to my entire newsletter. So this is a great bonus for those suffering with poor digestion or even gastroparesis to help you start improving today. For those who want more than just a few tips, has an extra C. Thank you. I may have. I'm horrible at typing. Okay. So Amy Shipman, I think you just did the other one, mycrazyjourney.com/freebie. So if you guys are watching this, go down to Amy Shipman. She has reposted that link for me. Thank you, Amy. I really appreciate that. So for those who do want more than a few tips, then I want to tell you how you can work with me one-on-one. As I mentioned before, all cases are in a joint effort, or I was supposed to mention before, all of my cases are managed by a certified functional medicine doctor and our second functional medicine doctor who is in the process of that 5-year certification. So anyone who works with me gets the benefit of my experience, food and lifestyle coaching, as well as functional medicine, the tests, supplements, et cetera, are all included in our packages. Each package is custom done, so we can't answer any questions about what yours would look like. This, at least not in this format. So this means that working with me gives you a whole team working on your cases. But to get a consult with me, you must qualify. To see if you qualify, you must call my office, and in a few minutes, I'm going to put that number in the comment box. But because we are extremely busy, we ask that you do not make this appointment unless you meet our basic criteria, and we ask that you make it with integrity. And this means that you have to be willing to change your diet and lifestyle. You have to be willing to take the lab test, and you have to be willing to put your health as a #1 priority for the duration of the program, and maybe longer. And that means your health has to come above other things in your life. You have to be willing to make hard choices. Sometimes we have to choose between what we want and what we need. Sometimes we have to say, okay, I'm not going to go on that vacation right now because my health needs to be the #1 priority right now. And that means making, again, those hard choices and putting it needs to come first. So we also need to know that you're willing to do that, as well as follow our recommendations and do the program as it was designed. As I said, we custom blend these programs for you. Your testing will be different than my testing. Your some things are, those testings have to be done though, or I can't tell what's going on inside your body. I can use the diagnosis and what your other doctors have found you. For example, I don't need to re-find out if you have dysautonomia. I don't need to find out again if you're hyperadrenergic. I don't need to find out through an expensive test if you have high blood pressure or low blood pressure. You're going to tell me a lot of your information, but some we have to find out because they change so quickly, especially hormone levels. So if you decide to do that, I'm going to type in the number to my office. This number, we do take remote consults. And if you qualify for a free consult, it can be done over video chat, which means we can take anybody within the United States, anywhere where we can find a lab in your city or mail you supplements or connect with you over Wi-Fi and internet. We can take your case, assuming that you are accepted. So I'm putting in that number right now. That is the number to my office at Integrative Health Center of Alabama. Sydney, our receptionist, will find out whether or not you qualify. And if you qualify, she will find the first available spot in order to do one of those consults to see whether or not you could be accepted into the program. Let's see, I want to leave you guys with a little encouragement though. So when I first decided to tackle my POTS, I, of course, did research. And the number one tip that I came across with was a big determination of whether or not I was successful and whether or not I will continue to be able to get through that last little 5%, and that's fixing my physical environment. I want to leave you with that same recommendation. Don't give up. The worst thing that you can do when diagnosed with postural orthostatic tachycardia syndrome is to give up. So many of people who have POTS, they have an inflamed deep limbic system, which is associated with depression and a negative outlook. They tend to believe that nothing, and I use these, I want you to notice these extreme words I use: nothing, always, never, can't. Those are extreme words. This is a sign that you may have some depression or a negative outlook on life. So they think that nothing can help them and are overtaken with hopelessness and tend to convince themselves that they will always be sick. They believe they will never get well and that they can't do it. And if you think that, then unfortunately you're right. You can't. So don't get me wrong. You're allowed to have a bad day. So have a bad day. But get up the next day and try again. This is what's going to determine your success. Sheer determination and will. Lost my place. Okay, so now, of course, some things, if you get through the same things, you're never going to get results, regardless of your will and determination. So yes, you need to try new things to get new results. But it's not the getting up after life knocks you down, or let me rephrase that. It's the getting up after life knocks you down that determines whether or not you get to try those new things. And you can only do that if you believe that there's something out there that will work. So if this is your next step, if you're one of those people who believe nothing's going to help you or you'll always be sick, I want you to work on that first. I want you to work on that first and then ask for someone to help you with what the right choices are. Let's see, if anybody has any questions, I'm going to scroll down on my thing right here. Do you use coffee enemas in your protocols? A coffee of any sort would be a reintroduction for these people because of many of them and most of them carry a celiac gene, and they may or may not be triggered by this, even without their knowledge or conscious knowledge that they are being triggered without. Allie says, yes, 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 love those criteria. Thank you. Got the number for me. Can you take Canadian residents? We will consider it. The main defining factor of whether or not someone would be accepted, other than their own qualifications that everybody else would have, was, can I find a lab that does the lab test that I know how to help them with? Or can I mail them the supplements and get them the brands that I need to? So that would be something. So Katie, if you're Canadian and you want to investigate that, we will be happy to investigate that with. Go ahead and call us, find out, put your name on the roster. And once I see your name on that roster, let Sydney know that you're from Canada. And if I see that someone's from Canada, I will go in and investigate, and I will find out, are those labs also in your city? Are those supplement banks? Can I still send them to you? Many of them will say yes, but we just need to verify that, what we're working with to be able to answer that fully. You're welcome, Katie. Let's see if I have any others. I want to make sure I had pinned a comment from Angela. She said, if the markers are the same, how can you tell which is which? That genetic test will be a lot of it, the physical environment, the medical history. I'll be able to tell that. My experience with these cases, I find that when people are systemic, that either started, the medical history either started in their brain or with their ovaries or other gonads, testes, so hormonal things. So a genetic test, the medical history, and the individual and what their cases and symptoms are, I'll be able to put that puzzle together for the individual and find out what really caused theirs. But if you have SIRS and you also have dysautonomia, you just have SIRS. It doesn't mean you don't have dysautonomia. It just means it says your SIRS is expressing itself as dysautonomia in addition to fibromyalgia or thyroid or whatever else is in your individual case. Of course, every case will be different. Okay, I'm just going to stay for a few more seconds, make sure nobody has any questions. If they don't, please follow the link up front, sign up for my newsletter so you can get that handout on improving your digestion. If you want a one-on-one, my phone number is there. I don't see any other questions, so if nobody has any other questions, I'm going to sign off. Thank you so much for having me today and the last few weeks. If you want to see my other talks, they were on January 22nd and 29th at the same time, 11 a.m. Central or 12 Eastern Time. Jan says, will your gene tests show NCGS as well as CD? I can't answer that real quickly because I'm not familiar with it. It will tell me specific genes, like a group, several groups of genes, and if that will reveal the NCGS, I don't know that right off the top of my head. I apologize. Thank you so much for everybody joining us. Sorry I couldn't answer that better, Jan. Oh, non-celiac gluten sensitivity. I'm sorry, I didn't put that together. Jan, yes, it will tell me. Oh, not absolutely, but I've found it in several people. And because it gives me the genes that are on that line. So yeah, it can tell me, yes, it can, possibly, most likely. Okay, thank you so much. Anybody has any questions, shoot me them. I'll be checking this the next 24 hours to answer those for you. Y'all have a great weekend. Happy Monday. Thanks a lot. Bye.